I want to sincerely thank you for being my patient or listening to my information and attempting to help others as a professional. This particular video is on blood oxygen level test, on the blood oxygen level test. This is kind of an important, very important thing, which we very often don't associate with TMD, and it has to do with breathing and sleep and other issues. And just to review, the Atlanta TMD Institute has three purposes: to educate dental and medical professionals in TMD, to develop knowledge of TMD or temporomandibular disorders, which is really lacking, and to successfully treat patients suffering with TMD. And whatever your purpose is, this is absolutely a very, very important topic that involves several videos. And once you come to see the importance of breathing to the body, it just is overwhelming how many problems can occur when people don't breathe correctly. And this is particularly interested in dentistry right now because of obstructive sleep apnea. But there are many conditions where the inability to breathe is not as bad that you choke to death, but is really likewise causing major problems in a person's body. And we'll delve into this and try to give you a full understanding of what this test is, because the test is a tool to see if you're breathing correctly. The test is a tool to see if, after you do several types of breathing exercises, if you improve your breathing. And it's also a tool to what they call objectively to actually measure and see your progress. Again, and what is the subtitle? It is how to measure breathing improvement after doing prescribed breathing exercises. And we will, in future videos, go through ways to improve your BOLT score and improve your breathing and improve your sleeping and many other different things that are just a wonderful consequence of simply doing exercises. Isn't that something? And they're free. Not free, but you don't have to pay anything. You don't have to have any special equipment. You can do these exercises alone at home and improve your breathing situation. The blood oxygen level test is abbreviated BOLT, B-O-L-T. So we're going to start with just asking the question, what do the words mean? What does the term mean? What is the blood oxygen level test? What's the BOLT test? What is it for? What does it mean? And let's go through that so that you can kind of understand what this test is measuring. I'm going to compare the BOLT test to a kind of thermometer, except the BOLT test is done by you instead of using a thermometer. So you use a thermometer to measure your temperature. Obviously, this patient has a problem and they are taking their temperature. And the temperature should be normal based upon looking at the thermometer, 98.6. Pretty much everyone understands how a thermometer works. Thermo means heat, meter means measurement, or heat measurement. And we know what's normal. So using a thermometer, we can determine what is normal. And the average human being has a 98.6 degree Fahrenheit temperature. And when it's higher, they say you have a temperature or a fever. When it's lower, you have some sort of problem with your thyroid probably. So when you take your temperature with a thermometer, you know that 98.6 Fahrenheit is the normal human body temperature for most people. You're using the thermometer to determine what's normal and what's not normal. Got it? Whether you're normal or not normal. And you're going to be using the BOLT test to determine whether your breathing is normal or not normal. It's a tool. So it's really neat. The BOLT test, using the BOLT test, you can measure how much oxygen you can store in your blood and tissues simply by doing this simple test that you can easily do at home, and we're going to teach you how to do it and think about it. So I want you to understand it. I think it's critical that you always understand what you're doing and why you're doing it and what it means, because you are in charge of your health. Hippocrates said, this is true, look it up, that a patient that doesn't consider themselves their own doctor is a fool. And this is true. So here's what you're going to say, well, wait a minute, Dr. P, I go to a doctor to tell me what to do. Yeah, no, he advises you. The word doctor comes from the Latin word docere, which means to basically mentor you, teach you, or a teacher. So the way to measure the amount of stored oxygen in your blood is using the blood oxygen level test, or BOLT, B-O-L-T for short. It tells you the capacity of your lungs, blood, and tissues to store oxygen inside your body. You know, you want to be able to store lots of oxygen in your body. And when you have dysfunctional, bad breathing, right? What we very often call hyper means too much, ventilation means breathing, hyperventilation, and there's something called hyperventilation syndrome, that if you don't breathe correctly, you're not going to be able to have much reserve, you're not going to be able to store much oxygen, and you're just not going to be doing well, right? And how do we know how much oxygen you can store? Well, we're going to see it inside your body based upon the amount of seconds you can comfortably hold your breath. So now I hope you're asking the question, how do I do a blood oxygen level test at home, Dr. P? So let's go through exactly how we do a blood oxygen level test at home, step by step. Look at the video, think about the video, and you can possibly look at it a couple of times so that you get down exactly how this test is done. So to do the BOLT test, you're going to need to use a timer of some sort that keeps seconds. And you'll see that this clock has a second hand. There are a lot of ways of keeping time, especially nowadays with iPhones and smartphones and iPads. So there are just lots and lots of ways to keep time, to record the amount of seconds that you can easily, comfortably hold your breath before you get a first hunger or air. And most smartphones have timers. iPads have timers. There's just multiple ways of, well, almost all smartphones have this, and you can download an app for free if it's not there already. But you can do it with your smartphone, or you can do it with your iPad, and you can put a timer in front of you, because you want to record the number of seconds it takes from starting the hold of your breath to the first sign of some sort of air hunger or reason for you where your brain is telling you to breathe. So after you've set up your timer but haven't turned it on yet, make sure you're wearing comfortable clothes in a very quiet area. Sit down, relax in a comfortable chair for about 5 minutes or so. I've got both of these images because the woman on the right, she's relaxing and thinking about things. That's kind of the mood you need to be in. But you're sitting in a chair also. Perhaps this woman is engaged with us, looking at you too happy. Right now, you're just in the chair, trying not to think about anything, just relaxing, and let your body go and just breathe as you normally would breathe. So while you're sitting in the chair quietly for the next 5 minutes or so, try not to think of anything. Clear your mind. Just relax. You're not trying to meditate. You're just relaxing. And that's kind of important. So take some time before you do the BOLT test to let your body just let go. So for the purpose of this test, we want your body to be relaxed and breathing normal, not trying to take a deep breath or trying to keep a strong expiration. All you're trying to do is just sit there and just relax and breathe normally. So quietly and with minimal effort, not trying to press anything out, take in or press in, not try to suck anything in. Take a normal, regular sized breath. So you take it in and stop. So taking a breath into your lungs is called inspiration. Got it? Inspiration. And you'll notice if you look at this guy's nose, the air is going in, the arrow is going down into the lungs, and the diaphragm, if you look, is descending, contracting, going downward. Got it? And the intercostal muscles are contracted to open up the chest so that the air will come in. The thoracic cavity inside your ribs gets bigger. So here you've taken in, a regular breath. You've allowed it to come into your lungs through your nose, no mouth. Um, and then at a certain point, you stop and you reverse. You start pushing it out, and that's called expiration. But at the end of the inspiration, breathing in, slowly let the air out of your lungs. And you can see that the diaphragm, which is the muscle right, right up, but that divides your thorax, right, your rib cages from the abdomen, which is your stomach area, that diaphragm relaxes, you inspire. When the diaphragm contracts, the air goes out. So when the diaphragm contracts, the air is pushed out. So there's a name for letting your breath out, okay? And it's called expiration. So letting a breath come out of your lungs is called expiration. And notice the diaphragm goes up when it relaxes, right? It doesn't, it pulls down and straightens horizontal when you breathe in. But when you breathe out, your diaphragm just relaxes and goes up. And the vertebra, the vertebra and the intercostal muscles close and push the air out. Notice the arrows coming out of the nose. And again, during this whole test, you're breathing through your nose, not your mouth. Very important. So that's expiration. So you've taken a gentle inspiration. You breathe in gentle, and then you've let it out gently. At the end of letting it out, pinch your nose. So at the end of your expiration, letting it out, pinch your nose closed with your fingers, and this is when you start timing with the timer how much time you can comfortably, and I say comfortably, have your breath withheld with no breathing. As soon as you feel uncomfortable, as soon as you feel muscle twitching, or as soon as your brain says, "Oh no," this is where you end the bolt test. So it's very important while you're doing the bolt test and holding your breath that you just relax and sit comfortably. Don't let anything distract you. Don't be thinking about anything. Try to just, stay there, hold your breath until, and calmly, sit calmly until the first sign of something that wants to make you breathe, whatever it might be. It could be you just want to take a breath, your brain tells you to, or it could be one of the muscles in your stomach or your chest starts contracting. Whatever it might be, that's the end of the test. But please, now, sit quietly and don't breathe. Just relax. So during the bolt test, after you've taken your breath out and hold your nostrils, you're relaxing, you're continuing to sit, you're continue sitting. And you just remain comfortable while not breathing. Just sit there, relax, Z out until you experience the first sign of air hunger. You want to breathe, you have to breathe. Your brain is getting a little bit upset. It wants you to take a breath. So you see this young lady here, she's just exercised and now she's like out of breath. This is way too much air hunger. This is you just want your first even mild sign of air hunger, the first sign that you want to breathe. That's when you stop the test and end the counting. It is really, really important that you don't confuse what this bowl test is. It is not how long you can hold your breath. It's not like going to the pool with some friends, going underneath the water and holding your breath as long as you possibly can. No, 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 that's not a bowl test. That's how long you can hold your breath underwater. What we're looking at is the amount of time that you can sit comfortably before your body starts becoming concerned about its oxygen. So in other words, when is your body concerned about oxygen? When you've used most of your oxygen up. When does that occur? When the CO2, carbon dioxide, increases beyond a tolerable amount. So it's really important. You're not trying to hold your breath as long as you can. That is not what the bowl test is. The bowl test is when you very first, even mild, feel like you should breathe. That's the end of your bowl test. Stop the test, take the time. So if for some reason you're crazy and you keep your breath too long, that's not really a bolt score. That is a breath holding contest. And that doesn't, that is not a bolt score. The bolt score is hold your breath, gently relax, and the first time, the first pang for hunger, the first air hunger, the first contraction of your diaphragmatic muscles, anything that makes you want to start breathing, that's the end of the bolt test. And most likely you've kept on beyond, so you have this need to desire to breathe, but you keep your breath hold. Well, wait a minute, that's longer than what the bolt test is. So if you do hold your breath like underwater, that is not the bolt test. It's going to be longer than the actual bolt test results. So again, and I'm going to hit on this a lot, this test is not how long can you hold your breath. No, no, it's you're just holding your breath until you feel the first desire to take a breath. So you're sitting there, you're kind of comfortable, nothing's going on, and all of a sudden you feel like you got to take a breath. You've got to take a breath. That's the end of the test. At the first sign or first desire to take a breath. This is called air hunger. The first hunger. You're hungry for air. So sometimes the first sign of air hunger or the first sign of wanting to breathe might be a muscle inside your rib cage. Inter means between, costal means your ribs. Intercostal muscles, they're used for breathing. And it could be they're like, oh, hey, wait a minute, I've got to breathe. And the muscle is going to do what it can to breathe. And so you might feel your muscles contract or spasm or twitch. That means that that's the end of the test. That is your first sign. You didn't maybe feel a desire for air hunger. You didn't want to take a breath, but your body did. So that's the end of the test. So if a breathing muscle in your chest starts twitching, this is also a sign of air hunger. And you should stop counting. And that's the end of the test if this twitching occurs. So I love science. I have a biochemistry degree, magna cum laude, Phi Beta Kappa. I am a smart guy. That's crazy. But chemistry's always interested me a great deal. And the world right now is really concerned about this gas called carbon dioxide. So air hunger happens. It occurs in your body. Air hunger happens when a gas called carbon dioxide builds up in your blood. Got it? Carbon dioxide tells your brain when to take a breath. And when carbon dioxide gets up, your brain wants to get rid of that carbon dioxide and you'll start breathing. This is very important. And the letters mean something. C stands for carbon, and our whole body is made out of carbon. Got it? We are a carbon-based animal. Very important. And you'll notice O2. CO2. O2 is oxygen, isn't it? So carbon combined, stuck together with two oxygens is called carbon dioxide. And that is the greenhouse gas that is causing all the temperature problems that you're seeing right now. Isn't that interesting? So in our atmosphere, more and more carbon dioxide is building up at a greater rate. In other words, there's way more carbon dioxide now than there was 200 years ago in the world, up in the air. So a brain dies in 6 minutes without oxygen, so it's going to freak out if you don't have oxygen. When your brain feels that there's too much carbon dioxide in your blood and you're not getting enough oxygen, your brain makes you breathe. And that's one reason why you see a lot of anxiety, depression, nervousness in people that don't breathe well, because their brains are being screwed with. Their brains want oxygen. Their brains need oxygen, and they freak out when they don't get oxygen. But again, when your brain feels there's too much carbon dioxide in your blood, your brain makes you breathe. It doesn't want to die. And in this particular test, the Bolt test, it's just the first feeling of breath. It should be light, not emergency. Like, it's not like, no, it's not that. It's not like, it should be just you want to breathe. And that's the end of the test. So at the end of your Bolt test, right when you feel the first slight, easy pang of hunger, air hunger, you should be able to breathe normally without panting. It's like totally normally, like she's sitting there, she's breathing, no big deal. That's how you should breathe at the end of your Bolt test. If, however, you're struggling and panting, you held your breath too long. It's not really your real Bolt score. So again, you should be able to breathe easily. If you're breathing difficultly and you just can't seem to get reoriented, relax for a little while, and you're going to need to repeat the test, because at the end of the test, when you stop the count in seconds, you should be able to then breathe easily without taking heavy breaths or panting or anything. So let me say, if you have to gasp for air, or you have any problem at the end of the test breathing, or if you have to breathe fast to recover from holding your breath, you've held your breath too long. And this is not your real Bolt score. You've overshot the runway. You've done it too much. You did too much. You ran out of fuel, just like this plane during World War II. So when you hold your breath too long, that's not a real Bolt test, right? So when you hold your breath too long, you'll have difficulty breathing at the end of the Bolt test. You just won't be normal. And that means it's a bad Bolt test. You got to do it over. And your real Bolt score is going to be lower than the one you've recorded, because you really overshot the mark. You held your breath too long, and that's not really a reflection of your normal blood oxygen level test. So again, remember, when you started this exercise, you started the Bolt test by taking a gentle inspiration and expiration and then pinch your nose. You should be okay. See, she's okay. Her thumbs up. So you keep on holding your breath, not breathing, gently, relaxedly, until you feel that first sign of air hunger, whatever it might be. And then once you feel that air hunger, stop the test. Stop your timer, or look at your timer and record what the number was. And that's the number of seconds that you can comfortably sit after stop breathing, where you first experience air hunger. Write down the number of seconds from when you first pinched your nose to the first sign of air hunger, again, without you being uncomfortable. You shouldn't really be uncomfortable. That means you've held your breath too long, because the first sign is, you should be able to recover easily. All right. You should be able to just breathe normally at the end of your bolt test. But at the end of your bolt test, if you can't breathe, you're gasping for air, right? Or you're holding yourself, you've gone too long. That's not really your bolt test. The bolt test is when you first have an air hunger and then you breathe and you're okay. If you are gasping for breath, you went too long, your body didn't have enough, you've used up too much of the oxygen, and you've gone beyond your real bolt test number. So again, the first sign of air hunger, you stop the test, you look at, stop the timer, or you just look at the number. This is your bolt score. So the bolt score is from the time you first pinched your nose, comfortably relaxed, and then you had your first feeling that you wanted to breathe. That's your bolt score. So what does your bolt score really mean? And why am I sitting here spending all this time trying to teach you this stupid test, right? It isn't stupid. It's important. It is a way of measuring whether you're breathing well or you're not breathing well. It's a way of measuring whether you're getting better. We're going to give you exercises, and if you don't do the exercises, your bolt score is not going to get better, right? If you're doing them well, most of the time your bolt score is going to get better. So the bolt score tells us how much reserve, how much oxygen that you've got inside your blood, your lungs, and your tissues. And we want you to have more and more capability or capacity to store oxygen in your body, because oxygen is absolutely necessary. You die within 6 minutes of not having oxygen. Oxygen's critical. And so what does this bolt score mean? So remember that the bolt score is in seconds from the time you stop, exhaled, and hold your nose to the amount of time to your first hunger, right? And it comes out in number of seconds, right? That's how it's measured. A bolt score of less than 25 seconds probably means that you have a breathing disorder. And that's going to screw you up in so many ways you have no idea. And again, a bolt score of less than 25 seconds probably means that you have a breathing disorder, which is probably causing muscle pain. Now, 90% of TMD patients complain primarily of muscle pain. Most of the pain that a TMD patient has is muscle pain. So if you have a breathing disorder plus a joint problem, you're going to have a lot of pain. A bolt score of less than 25 seconds can also mean that breathing disorder is going to cause inflammation, right? Tenderness in your muscles, joint pain, joint inflammation. That includes the temporomandibular joint. Get this, nervousness and anxiety, and possibly even depression. And this is what gets me upset, seriously upset, with the medical community, because they won't look at all the different reasons that someone can have anxiety or nervousness or depression, and they simply give drugs without ever asking, does this person have a vitamin D deficiency causing depression, and pain? Does this person have a breathing problem? Is this person not having enough air? There's just a lot of things. And the bolt test is going to tell you whether you breathe well or not, and it could possibly explain some of the symptoms that you're experiencing and why you have more dramatic symptoms than a person with the same problem, but you have the breathing problem in addition to the joint problem. Unfortunately, there is a whole list of things terrible things, lists and lists of stuff that people have when they have breathing problems, when their bolt scores are low. Unfortunately, the stuff I just spoke about, that's just the beginning of a long list of medical problems that you can experience that incorrect breathing can cause. And so often it is misdiagnosed as something else, and you're put on medications, or you're labeled as crazy, or you're this is an anxious person, she can't control herself, she's just unstable psychologically, but yet it's a breathing problem, or it might be a blood sugar problem. There's a lot of reasons that people have symptoms. Breathing is fundamental, and this is one of the things that we look at with every single patient that comes into the Atlanta TMD Institute. So we're measuring this bolt score. It will tell us as you might have a sleep problem, and I want to make sure you understand that breathing disorders can also cause sleeping disorders. And wait a minute, which are commonly associated with TMD, temporomandibular disorders. Many people wear a CPAP, and this poor guy has to wear this whole apparatus to sleep and to be able to not die in the middle of the night. And these are all interconnected. We should never think that the human body is one thing. I mean, a lot of dentists believe that they make these appliances like plumbers or carpenters, and they put these things in the person's mouth, and they don't understand, well, wait a minute, that's affecting the tongue, my breathing, the joint, the head position, sleeping, how much oxygen, affecting how much oxygen is happening. You are a human being. You have many different problems, and they all interact to form you. So we need to look at everything. And again, the BOLT score could indicate that you have a sleeping disorder that we're going to need to address in your therapy. Okay, so we're teaching you what a BOLT score is. And the next question you might ask is, well, when should I take my BOLT score? Well, first of all, when you first start your first a patient with us, we might do the BOLT score right there in the office, or we might have you do it at home. That's to see whether you're doing okay or not. And it's also to record your situation when you first started, because we want you to improve. Then, if we see that you have a low BOLT score, like under 25 or 20, we're going to do breathing exercises with you. And you're going to do those breathing exercises at home, and you're going to do them every day, multiple times per day, trying to improve your breathing and your body and your sleep. Then, each week, you're going to measure your BOLT score again, and we're going to hope that we will see the BOLT score improve over weeks and weeks and weeks of your practice at home, the breathing exercises at home. So when should you take your BOLT score? When you first start. When should you take your BOLT score? Weekly, to monitor and see how you are progressing. So, when do you do a BOLT score, and why do you do it? When do you do it? Well, when we're first assessing you and trying to determine what's going on with you, we are going to want to look for all the problems that you might have, including like thyroid problems, sleeping problems, breathing problems, swallowing problems, walking problems, digestion problems, gastric regurgitation, bunches of stuff that might be related to your TMD. The BOLT test is something that if we suspect that you have a breathing disorder, we'll probably do that in the office with you, or we might send you home and have you do it at home. So your BOLT score is measured before your TM therapy begins as a way of understanding what's going on with you, and we're also going to look to see if your BOLT score improves with your therapy. Your BOLT score is measured before your TMD therapy begins and before starting to do breathing exercises at home that we prescribe for you if you need them. So if your BOLT score is low, we're going to do breathing therapy at home. You're going to do that. We'll teach you to do the exercises, you'll look at the videos, and you'll get started. And over the next 3 to 6 months, we hope and pray your BOLT score will improve. Most likely you're going to be out of pain within 6 weeks, but I want you healthy forever and ever and ever. I want you to have the best possible life that you can have. I want all the various things that are causing problems physically, health-wise, to be taken care of. And a lot of people differ. I have a couple of other TMD people who differ. They think we're just supposed to get you out of pain. Oh, the patient came in just to get out of pain. That's all you're supposed to do. But wait a minute. If the patient has lots of different other problems, let's take care of them. I want to be as healthy as I can. The other practitioner says, well, they didn't come in for all that. They're coming in only to get rid of pain. And I propose to you that this pain is a combination of lots of different things. And just doing one or two things to get rid of the pain is not really permanently getting rid of all the problems. Let's get rid of all the problems. So if you have an abnormal bolt under 25, we're going to work with you to teach you how to breathe better and improve the oxygen capacity of your body. And this will be reflected in your bolt test scores as you take them again every week. We're going to prescribe breathing exercises and drills and things for you. So the breathing exercises, which you're going to do at home, they are designed to improve your bolt score and to reduce or eliminate unwanted bad breathing symptoms. And boy, there are lots and lots of them. This video teaches you the bolt test. We're not going to get into all the crap that can happen when you have a breathing problem. So if your bolt test is under 25, you got a breathing problem, and there's probably a lot of stuff happening to you that you may not even be aware of related to this breathing issue. Because breathing is fundamental, and the brain dies after 6 minutes without oxygen. It's a big deal. So I'm asking you to take this bolt score test, right? And you're thinking, well, what does the bolt score mean? I mean, when I get a result, doctor, what does it mean? So a lot of times people will have blood tests and then they go back to their doctor for a special visit just to look over the blood test so that the doctor can explain what all the test results mean. I think you should know what a bolt score means. And so let's delve into this a little bit. So your bolt score tells you how well and how much you can store oxygen in your body. Got it? So when you stop breathing, you're not bringing any oxygen into your body at all. So the longer you can sit without breathing, that means you're using your stored oxygen, right? The stored oxygen. And we want you to improve and increase the amount of stored oxygen in your body because oxygen is essential for life. If you remember, we talked about the mitochondria, which are little powerhouses inside all of our cells. And those mitochondria, they use oxygen to generate the power of a molecule called ATP, or adenosine triphosphate. So you've got to get that oxygen in your body. So a bolt score of 25 or lower means you suck. You are not doing well. You cannot exercise easily. You may have asthma. You're probably not sleeping well. So a bolt score of 25 or lower means that you're significantly lower than normal people. And it is important for you to do the prescribed breathing exercises that I give you to improve the amount of oxygen that you can store in your blood, which means your body is going to function better after doing the exercises in order to get your bolt score up, which means you're able to keep and store more oxygen. Got it? It's kind of like a pantry, and like there's no food. So how much food do you store in your pantry? If you got a big old pantry and there's a problem with a hurricane or something goes on, you can stay many days in the home with the stores that you've got. And basically, the bolt score tells us how well you can store away, put away in a pantry, oxygen in your body. And oxygen is life. So, like, where would you want to go? What's a good bolt score? What's a really good bolt score so that you can exercise well and sleep well and feel well and just have lots of oxygen capacity A Bolt score of 40 is very good, and it would be good to, obviously you want to get your Bolt score up as high as you can, but if you can get to 40, that is really good, and it's a good goal. It's a very good goal. So if your Bolt score is low, which many TMD patients do have a low Bolt score, we're going to be prescribing breathing exercises specifically for you to do at home every single day for the next few months. And you're going to use this Bolt test that you learned today to measure your improvement. Uh, it's extremely important to do the exercises regularly, multiple times per day. We're retraining your body to experience a different existence, right? A different way of functioning. And you have to train your body to do it. It just doesn't happen, unfortunately. So remember, your Bolt score is low, you got to do the prescribed breathing exercises. Those are other videos. This video is just for you to learn how to measure your improvement, how to measure how you started out, and to measure how you end up. The Bolt score is your thermometer. It is the way of measuring your improvement. So it's your responsibility to do these breathing exercises. You know, you're paying money to get healed and then you don't do it. We have patients like that. They'll come in, we'll make an appliance for them. They won't wear the appliance to support their jaw joint. You know, we have one lady come in for real who didn't wear the appliance at night, didn't go to physical therapy, had a terribly blocked nose and did not go to the ear, nose, and throat doctor. And she's just mad that she wasn't getting better when she didn't do anything, right? She didn't do anything. These breathing exercises that we're prescribing for you will hopefully improve your Bolt score. But why are we improving the Bolt score? So that we're going to improve your overall health and sense of well-being and feeling of happiness, right? We want to eliminate anxiety and depression. We want your body to heal quickly. We want your muscles to be happy. There's just a lot of things that these breathing exercises will help you with, but you've got to do them. So I became a, pain doctor, a TMD doctor, temporomandibular disorder doctor, or facial pain doctor, however you wish to call me, to help pay people. I really do. And I'm going to do everything I can to alleviate and eliminate the pain in my patients. And you know what? I swear to you, almost all patients, almost all of them have their pain eliminated within 6 weeks. Pain is usually easy to get rid of. What, however, I want to do is make you healthy so that pain doesn't go back, and to make you thrive, do extremely well, feel great, and just have a great life. So again, I especially want you to sleep better because you got to heal and have less pain. And doing breathing exercises is one way of many to assist you in improving your sleep and reducing your pain, but especially sleep. So I can't teach you everything at once, even though I'm totally excited about this information and the changes that can possibly affect your entire life, including getting deep sleep, feeling better, feeling refreshed. It is just so important. But right now, I just want you to learn how to do the Bolt test so that you can actually begin monitoring your progress. We've got to start somewhere, and we're going to start with measuring your current situation and measuring you as you get better until you improve to your maximum ability. So yes, in later videos, we'll review how bad breathing is toxic. Toxic meaning like radiation, toxic meaning like poison. Bad breathing is so toxic, it will destroy much of your life, all your thoughts, make you ADHD, make you depressed, make you hurt. Bad breathing is just toxic. And we want to get into that. And I hope that the more you learn about it, the more you will be motivated to do these exercises every day and to take your Bolt score weekly. So in later videos, again, we will review how bad breathing is toxic and how training yourself to breathe right can possibly change your life. So you want to do the exercises that I prescribe to you so that you will train your body to breathe right. This particular video is primarily oriented, and the goal of the video is to teach you how to do the bolt test. That's what you need to walk away with at the end of this video to be able to perform it yourself and be accurate. In later videos, we will review how bad breathing is toxic. You got no idea. It's amazing. I am overwhelmed with the list of problems that people can have related to their breathing problems. I mean, breathing problems can cause diabetes. Breathing problems can cause sleep disturbances and destroy your REM sleep so that you're a miserable creature. There's just sleep disorders, bad breathing can cause regurgitation, it can cause depression, it can cause anxiety. Of course it's going to cause anxiety because you're not getting enough oxygen and your brain can only live 6 minutes without oxygen, so it's going to get pissed and worried. And you're going to have anxiety, and you're going to be given anti-anxiety drugs. So again, in later videos, we will review how bad breathing is toxic and how training yourself to breathe right can improve your life. So today, looking at this video, please think about everything and let's master the bolt test because that's going to be important. You're going to be doing that at least once a week during your period of time being treated. So now that you've learned how to do the bolt test, sit down and do it. Do the bolt test. It doesn't take very long, less than a few minutes. So do the bolt test, write your score in seconds down, and today's date. Write today's date down also on a piece of paper so that you can refer back to your results, what you started with, and what you progressed to. Do the test. Write down the results so that you remember them. So the bolt score is like your temperature, like a thermometer, like we said previously earlier in the video. And I think it's important that you do your bolt score regularly, at least weekly, over the next few months in order to see is your bolt score getting higher and better. And you'll know that. So you'll see the bolt score go up and you'll see the symptoms, your feeling of well-being improving. But this is a scientific endeavor. We want to measure everything that we're doing. So repeat taking your bolt score every week. And you need to make a time to do this every single week in order to not forget to measure the bolt score. You're doing it to see if your breathing is improving, right? It could be that you're doing something wrong with the exercises or, something's going on that needs to be investigated and you need to bring it to my attention and we need to respond to it. Most of the time, however, you're going to get better. So again, repeat taking your bolt score every week to see if your breathing is improving after doing your prescribed daily breathing exercises. And the exercises are daily, multiple times per day. A lot of times you can do these exercises without tremendous interference with your life. But you've got to do the exercises regularly every day in order to get better. And you can see if you're getting better by repeating your bolt score weekly at a specific time every week. So I am going to do a step-by-step summary of the bolt test. And so you can sit and listen and maybe do the bolt test while I review what you're supposed to do. Find a place that's quiet with a chair that's comfortable, clothes that's comfortable, and sit down and relax for, 5 minutes. Try not to think of anything and just breathe. Normally, don't force yourself to breathe. Just sit there, relax, and breathe. Then at the end of the 5 minutes, take a breath in and then let the breath out and pinch your nose. At this point, you start timing the amount of seconds it takes before your body feels the first sign of air hunger. This is not a breath holding contest. You're only testing to the amount of time where you have air hunger or some muscle in your body says, stop breathing. When you experience the first sign of air hunger, stop, record the time. The time is your bolt test. Very well done. Thank you for thank you for putting up with me and listening to this and learning how to do the bolt test. And I really appreciate your being my patient. Thank you. I think it's always important to record your results so that we know if you're improving, and you can look at data or information that you've put down and learn about your body. Also, it's just, are you improving? If you're not improving, what are you doing wrong? But these recording your results allows you to scientifically evaluate your progress. There's a very famous scientist, Lord Kelvin, and he invented the Celsius temperature system. In the United States we use Fahrenheit, but in Europe it's Celsius. And he said that in order for it to be science, you must measure it, and that's very important. So keeping your progress in a tabular form over several months is extremely important. So the Buteyko breathing is only one thing that we do at the Atlanta TMD Institute. I believe that TMD is a cluster of a number of stuff, including breathing, uh, diet, sleep, lots of stuff. Um, but our purpose is to help people heal themselves. And we do have a worksheet that is free. If you want me to email it to you, I would be happy to do that. And you can email me at drpodolsky at the atlantatmdinstitute.com, and we'll send you a PDF of the weekly breathing monitor form, and you're very welcome to request that. This information is extremely interesting, but just totally mind blowing. I've always known that breathing is fundamental, that breathing has caused many of the problems that we see in almost all of our patients. We've seen it also with allergies. There's a book that I was introduced to in about 1984. Um, by Marks, Dr. Marks, who talked about respiratory problems and allergies in children. And I have been following this allergy obstruction thing throughout my life, watching patients and myself, and seeing the problems that my patients have. And breathing is a problem all over the place. It really is. And Dr. Konstantin Butenko's research basically is the basis of all the stuff we're teaching here. Even Patrick McEwen. Patrick McEwen wrote a book, The Oxygen Advantage, and I suggest that you get it through Amazon or a used copy through thrift books, and read it, because I'm just basically teaching you the techniques that Dr. Butenko originally invented. Evidently, Patrick McEwen went to visit Dr. Butenko in the Soviet Union and basically cured his asthma, learned how to breathe, and just Patrick's an exceptional person because he's not a scientist. I mean, he's not a dentist. He's not a physician. He's just embraced this information totally, and it's the passion in his life. Uh, there's just a lot of stuff all over YouTube about Patrick's techniques, which are adaptations of Dr. Butenko's work. So thank you to these guys. Thank you, Dr. Butenko. Thank you to Patrick for giving this information to the world, taking Dr. Butenko's work and giving it to the world. And I believe that if you seriously, do these exercises, learn about all this stuff, your life is going to be improved tremendously. So thank you so much for being my patient. Thank you for allowing me to help you heal your body and experience a better life. I desperately want to do that. That's why I became a doctor. And the Institute is my legacy to the world. It really is. Orofacial pain became a specialty in 2020. There's just a lot of confusion in the field even now. They haven't established orofacial pain clinics in all dental schools. Uh, it's going to happen, but there's still a lot of confusion. And the Atlanta TMD Institute goals are to help straighten that out. And I'm praying that I'll have an effect upon the world. I want to bless the world. I really do. Uh, so the Institute is to educate dental and medical professionals. We give courses. And we want to develop knowledge of temporomandibular disorders. I'm always looking to see what's going on with various conditions that relate to TMD, how they relate, and so we can help people, even with things like crazy, like Parkinson's. Got it? And then the Institute is uh, a organization that treats TMD patients also from physicians, dentists, other specialists from the region, Southeast United States. We've had patients as far as Raleigh, Durham, from Florida, from Mississippi, Alabama. They come from all over the place to be healed. That's what I do. Uh, and I'm hoping that we'll leave behind books and videos to assist people to get well. But thank you for looking at the video. Thank you for being my patient and helping me in this endeavor.